Hi, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin, where you ask questions about dentistry, whether there be questions as a dental consumer about different procedures or how to get a makeover smile, or if you are one that's pursuing dentistry as a career, as a pre-dental student, how to survive dental school, how to get into dental school, how to get into dental residency, whether it be a general practice residency or maybe even just a residency for specialty practice, and then surviving and getting into, after surviving residency, getting into the practice and the business of dentistry. You ask those questions and we get those answers to you. Be sure, guys, that if you like the videos, that you share them, number one, and then number two, subscribe to my YouTube channel, Dr. Darwin Speaks. And if you ever have questions and you want to hear a particular topic and you want us to share what you have problems about or what you're concerned about, you can always send me an email right over here at newdentistcoach@gmail.com. newdentistcoach@gmail.com. I don't want you guys to miss the videos. I post the videos every week, on weekly videos every week, during Monday, Wednesday, Friday, and now even on Saturdays. So I don't want you guys to miss the videos. Some really good content that's going to help you. Today's content and today's session is going to be back to our podcast and series on careers in dentistry. Careers in dentistry. And today we're going to be talking to a former classmate of mine who has a unique practice in dentistry. And where she's using a lot of implants and using them also for some full mouth rehabs, and using dentures and other and using the implants as a vehicle to have more retention in the dentures that she's placing. So today we have Dr. Jumoke is here. And Doc, how you doing?
I'm doing well. How are you doing?
I'm doing great. Thanks so much. I know you've got a busy life as a practice owner, but also as a mom and as a wife. So we appreciate you taking this time out today.
Thanks for having me.
Absolutely. So tell everybody about yourself, because not everybody knows you like me. So tell us a little bit about yourself.
All right. Well, my name is Oral Jumoke out of Darwin. My patients called me Dr. Jumoke. Some of them call me Dr. A. I graduated from Howard University College of Dentistry in 2001. I'm a general practitioner in a practice that is limited to implants and removable prostheses. I live in the suburbs of Atlanta. I'm married to my wonderful husband. We've got 3 wonderful boys. And so I'm a soccer mom, because I've got all boys.
That's right. Well, hey, we got something in common. Not only are we dentists, but we are also parents that are fully immersed into soccer. My 10-year-old is the same way. So I totally get it. Yours is just 3 times as much as mine.
Yeah, that's all we do on the weekends.
That's right. That's right. So you mentioned that your practice is kind of focused on and kind of limited to implants and dentures. So tell us like how you came into getting this title, this position.
It's so weird sometimes when you're in school and you find what it is that you like to do. That typically, that's always my that's what my advice to most people coming up is: find what it is that you like to do. So when I was in school, I was always in the removable lab. I don't know why, but I really just enjoyed it. I enjoy working with older patients, geriatric patients, and I just enjoyed it. So I got out of school and went into private practice and realized that most of the doctors in my area were sending all the extraction patients to me, and they were sending all their denture patients to me because nobody really wanted to deal with the denture patients. And for some reason, I just had a knack for it. And so that went on, and I knew that was where I was supposed to be. That's what I was called to do. And, when you're dealing with denture patients, like we all know, That lower denture is probably the most frustrating thing. So you start thinking, how can I make the lives of my patients better? And, that was when the implants came. And, now my practice is probably over 50% implants on that lower denture. That's what I do almost every day to help stabilize that denture so these patients can get back to close to normal life with their dentures.
Wow, that's amazing. That's amazing, and especially with implants being almost like the standard of care across the board. This is I'm glad we're talking about it today. So your training, you mentioned dental school, and most of us know when we came out of dental school 15 to 20 years ago, yes, there were implants, but we weren't learning a lot about them unless you were in a PROS program, maybe an AEGD program, maybe a GPR program, depending on where it was. But you really weren't learning a lot about implants. Tell us a little bit how your practice or how you have transformed as a dentist by implementing implants into your practice, and tell us a little bit about your implant training that you've have had and that you continue to have currently.
All right. So, graduated about 16 years ago. So I initially started with what we call the mini implants now. And then I've taken, a bunch of CE courses. I've taken some life trainings, both out of the country and in the country. Right now, I have a fellow and mastership in the ICOI. I have a fellow and mastership in the AIP, and I'm working on my fellow in the AID. And so those require just a ton of CE classes, a ton of hands-on training. Most all of them are post-graduation training. So you're taking a lot of time. It's an investment. You're taking a lot of time from the family to go for these 3-4 day courses, sometimes 2-week courses, to get yourself to a point where you're comfortable that you can offer this service to your patients in the best possible way.
Right. So,
and right now also, go ahead.
Now I was just going to say, so you have done and continue to do some extensive training in implants.
Oh yes, I know we spoke last week, and I'm actually in a class now, which is a 9-month program at the dental school in Augusta to get my AID fellow, and that's an intense program. It's 4 days a month for 9 months. So, it's definitely an investment and a sacrifice to get it.
Wow. So 4 days a month for 9 months, in addition to some of the other weekend courses that you've taken over the last probably 5 or 10 years, if not longer. So that training
is
pretty extensive.
Absolutely.
And that training is pretty extensive. And I'm glad you shared that with us because, I have residents and other new dentists that are coming out, and they think that just doing a residency 1 year, whether it be AGD or GPR, if they can get that experience in placing implants, that they're ready to go. And they're ready to place them and go right into private practice. And I try to, share with them that that's not necessarily the case. Which you confirmed just in your training.
Absolutely. When you're in that residency program, everything is, you're getting the perfect patient in a very controlled environment. So yes, you can place those implants, but there's so many other variables that come into play when you're in private practice, and you're trying to source the patient, making sure the patient can afford your service, making sure you're doing your due diligence as you're placing your implants, which probably the faculty in your school would have done. So you're just going in there and placing the implant. And I think the easiest part is actually dropping the implant in the bone. Everything else before that, the treatment planning and all of that, is so much more important. And that's why I'm on faculty with a program called Implant Pathway. It's a 4-part continuum, and we offer live training, which is very unique in that the live training is done in Arizona, and we place implants on U.S. homeless veterans. And so in as much as you're getting all the training you want, you're giving back to the people that give so much for our country. And so that in itself has been so just rewarding to be able to do that. But we also do it in a not as controlled environment as in the school, more like a real life experience kind of environment.
Right, right. And you mentioned a couple of alphabets as it relates to your implant training. Can you tell everybody what those designations, what they mean?
Well, the ICOI is the International Congress of Implantology. The AIP is the American Academy of Implant Prosthodontists.
Okay, gotcha.
Yeah.
So you're in the process of getting your fellowship and mastership in those two organizations. So
I have both fellowship and mastership, so I'm going for my diplomat.
Oh, yes, we're being diplomat status now. Oh my God, that's even better. I mean, that's great. So you got your fellowship, you got your mastership, now it's the diplomat, which is, again, a testimony to the level of training that's required to become a dental implantologist. So tell us a little bit more about your day. What's your typical day like in your practice, in your office when you're with implants?
So, my typical day is probably about 8 to 4. In the morning, I do a lot of consults, a lot of denture impressions. So those impression techniques come in handy. I do have an on-site lab, and they're able to turn around and get my dentures or whatever prosthesis that I have to get made. They're able to turn it around in a short period of time. I'm not shipping stuff out. So that's really great. Between 11 and 2, I do all my surgical procedures. So, be it extraction, full mouth extractions, placing implants for overdentures, implants for fixed hybrids, those are done around that time. And then between 2 and 4, I would deliver the dentures or deliver the hybrids that are coming in from the lab. And that's pretty much how my day runs typically every day. Wow. It's pretty consistent.
Wow, that's good. So you've got structure, you got a system, and it sounds like you've got, within that structure, you kind of are, and I may be giving it away, but you probably have some level of block scheduling where you're scheduling certain procedures at certain times of the day, and you're just duplicating that over multiple times during the week.
So, I have block scheduling, but I have to give credit to having just a great team. I don't think I can do what I do on a daily basis if I'm not surrounded with people that have bought into my vision and also have tenacity. Right. It's not easy to have surgeries every day. I mean, we do maybe 2-3 surgeries every single day, 5 days a week. Mm-hmm. So it takes a lot for them to do that, and they're consistent, and they're able to keep me consistent.
That's right. And a lot of that support that you get, I'm sure is also as a testimony to you as an owner, because you have to train them and make sure that they are helping you do the things that and hit the targets that your office and that your practice is looking to achieve. So, okay, so that's your typical day. You mentioned some of this before, but can we go a little bit more in detail? What are some other procedures that you typically perform as a dental implantologist and how you practice?
Okay, so of course I do a lot of serial extractions. I mean, full mouth extractions, a lot of implants, sinus lifts, bone grafting at the time of surgery, or bone grafting later, ridge splits to expand the bone, taking a lot of impressions, definitely. So those are every day for me.
Gotcha. Now you mentioned impressions, and with digital dentistry here to stay, or the digital component of dentistry is here to stay. Are you using digital for those impressions, or are you kind of more traditional at this stage?
So I do a combination of both, and it just really depends on what we're doing. So I do utilize an outside lab for some work. And if I'm sending something out of the office, I would definitely scan it. Mm-hmm. It will be digital. But if it's in the office, it's just so much easier for us and faster to just get a quick impression and send it to my lab.
Okay, gotcha. Okay.
Yeah.
So this next question deals with your compensation as it relates to your revenues as both a dental implantologist, but also as a business owner. I know the way your model that you have in your office is one that's kind of shared through other components throughout the country. So can you give us a little bit of an idea as to what one can expect as a dental implantologist that's also an owner of the practice? What can you expect as far as salary range?
So, there's so many variations in the income potential. And I think that potential is really dependent on how much you really put into it.
Right.
You can dental implants have come to stay, and they've become the future of dentistry. So, you can make quite a bit of revenue there, and you can run a very successful practice.
Mm-hmm.
I mean, I would say just averagely in a practice like mine, not even doing as much as I do, would probably be about $250 a year, just averagely. Yeah.
Okay. So that's 250 median, average, a little bit more, a little bit less to kind of give you an idea.
Exactly.
Right. So basically, as a general dentist that is also an implantologist or has dedicated and has made investments into getting more training into placing implants and other components that go along with the implants and procedures that go along with the implants, you pretty much, it sounds like, have boosted your compensation up to the level of what's comparable for some specialists that actually go to school, whether it be for endo, whether it be for pros, or maybe even for oral surgery. So that's interesting.
Absolutely.
That's interesting. So what would you say, and this is a question where we always get people that kind of start thinking and start spinning a little bit, knowing what you know now, 16 years in, especially with the last, I would say at least 10 or plus, really focusing on this area, this love that you have for lab work and surgery and becoming a dental implantologist. Knowing what you know now, what would you do differently?
I think the first thing I would do would be maybe being more intentional at the beginning about investing more time into seed courses, that I want, not what is available, but what I want. So in the beginning, all I did was I needed this many credits for my license, and I just took whatever classes were available. And I would have been more intentional because I think I would have gained more over time if I did that and not just go for what was available to me. And I think also I would have attached myself to a mentor much earlier because when I finally did, I did see the gains and the drive and the accountability, and that really helped my growth as a doctor. So I would have attached myself to a mentor a lot earlier if I know what I know now.
Right. Okay.
Yeah.
All right. That's
just
good.
Found someone that would make me accountable and someone that would push me. Yeah.
So someone that makes you more accountable. And what was the second one?
And help me grow. Someone that was there to help me grow, to motivate me, and to to push me along.
Okay, got it.
Yeah.
That's great. So with that in mind, what advice would you give or can you give for those aspiring pre-dental students or even dental students that are getting ready to graduate in a couple of years, that are, that want to take a track or want to do more implants, or just in general, like what advice would you give them?
I think the first thing is not to be narrow-minded. Okay. Be open to opportunities. I know when we're in school, everybody wants to go to ortho. and it's great. But we all can't be orthodontists, and we all probably have different skills. So really be open, you know, to just opportunities that will come your way. Find a mentor really early, you know, someone that is in a field that you like, that you can, you know, that can help you and show you what to do. So you don't have to run around in circles and lose time. Right. And then, you know, don't be a lone ranger. That would be my other thing, you know. Don't do it by yourself, and find out what makes you happy. I think I found that maybe 6 years out. Find out what makes you happy, and then, or what makes work fun for you. And that's what you should do. Because what makes dentists burn out is that we're doing what we need to do or we have to do, not what we enjoy to do.
Right.
So after a while, we get really tired.
That's right.
Exactly. So just find out something that makes you happy. And that way, when you go to work, it's like going to a party. At least that's what I did.
That's right. That's right. Okay. Yeah. I like that. That's good. Yeah. That's good. Be open to new opportunities and oh man, that's good. So these last 4 questions are questions we ask everybody. Number 1, what's your favorite day of the week?
Saturday.
Saturday. All right.
Yeah.
What's your favorite food?
So I'm Nigerian. Anything spicy. Just put some spice on it. I'm good.
Spicy, not necessarily like Cajun hot, but more spicy with flavor and everything else, correct?
Yes, yeah. Spicy and flavorful.
Okay. Mm-hmm. Good. And then what's your favorite procedure that you like to do on a daily or weekly basis?
It would be the overdenture cases. The edentulous person who's not been able to go to a restaurant to eat because their denture moves around.
Okay.
Those are the best because those patients are so appreciative, and it's a life changer. You're doing something for them that changes everything. So yeah, that's my favorite by far.
Absolutely. Okay. And then last question is, what's your favorite thing to do or action to do outside of work? I think I might know the answer to that.
My family's going to say sleep.
Sleep.
Sleep, work out, and spend time with the family.
That's good.
Sleep.
Okay.
Yeah.
That's good. That's good. So also tell us a little bit about one of the projects you're currently working on.
All right. So I'm working on a few things. One of them is an implant study group here in Atlanta. It's called the Atlanta Dental Implant Mastermind. It's an intimate group of doctors that come together, and they're mainly women, you know. So, you know, I didn't choose that. It just really happened. And we meet 4 to 6 times a year. We learn in a very intimate setting, like I said. And it's really a mentorship program to get people to step outside their comfort zone. Implant dentistry is kind of male dominated. So women might be a little squeamish about getting into it. And my goal there is to get this, if I can do it, anybody else can do it. And it's to really help them, to move them forward to do that.
Okay. And give us another project that you're working on. I don't want us
and then, of course, I'm working on my AAID fellowship, which is, like I said, it's very intense, but it's, you know, it's a big medal of honor within implantologists. So I'm going to get it. And then the third thing is I'm working on making myself more available to mentor, to guide, to encourage women in dentistry, women in implant dentistry.
Wow.
So I'm doing some speaking and some teaching here and there, and I'm hoping to kind of work on that a little bit more in the next year.
That's great. Before I forget, I want to get you connected with a group that's shown a lot of promise and a lot of expansion over the last less than a year. It's called Sisters in Dentistry. And I know
I'm on there.
You're there. Okay, so you already know with Dr. Sherelle Sly and all the other sisters all throughout the country. That's great. So that's good. Yeah. Connections already been made. Perfect. How can people get in contact with you? What's the best way for people to get in contact with you if they have questions or want to be part of your mentoring or part of this implant mastermind that you have?
So it would be my email. It's jadedoyin1@gmail.com. That's JADEDOYIN, the number 1 at gmail.com.
And we'll post that down below so people can have that to get in contact with you. Well, Dr. Jumoke, hey, again, thank you so much. I know you're busy. You're doing a lot of things. And well, we're just so grateful and appreciative that you took some time out to tell us more on how to become a dental implantologist. Best of luck to you in your pursuits of your fellowships, your diplomat status, and all the other projects that you're working on. Thank you so much.
Thank you, Darwin. Appreciate it.
You're welcome. And if you guys appreciate this video and you want to see more, be sure that you send us an email. Leave a comment down here on the video, but also send us an email at newdentistcoach@gmail.com. Also, if you're looking for one-on-one coaching and mentoring about getting into school, getting into professions, getting into specialty, we have a network of doctors just like Dr. Jumoke and others that can help you with that. Also, just go ahead and, again, send an email to me under the subject line of Coach Me at newdentistcoach@gmail.com. Again, Dr. Jumoke, thank you so much, and we'll see you next time, okay?
All right. You have a good evening.
Thanks. Bye.
Bye-bye.